Ben Nelson, who is a linchpin in this health care deal because of his restrictions on abortion, wanted restrictions. He's talking. Let's listen.
The things that I worked on that I think are important, and try to keep my focus there because they're still doing the manager's package in there, and I ought not to be the one to make the announcements about it. Well, let me say that at the outset, change is never easy, but change is what's necessary in America today, and that's why I intend to vote for cloture and vote for health care reform. On the floor of the Senate, in town hall meetings throughout our states and in one-on-one meetings with our constituents, we've all heard heart-wrenching stories of people who have been left behind or forced into bankruptcy or caught in the grip of a health care system that just didn't work as well as it should have. And while each of my colleagues may differ on how to fix the system, I know of no members who are suggesting that the current system is satisfactory. I know of no member who doesn't think that we need to change our health care system. Where we differ, and I say so with great respect to all of my colleagues on both sides of the aisle, is in the way we fix our health care system. And I believe in the free marketplace as the foundation of our economy and as the primary focus that should drive our health care system and our debate. And that's why I opposed the public option and yet supported the market exchanges. I truly believe that a competitive health care system will lower costs and provide better health care for the American people. And I'd like to touch on the issue of abortion. As you know, I have strongly held views on the subject, and I have fought hard to prevent tax dollars from being used to subsidize abortions. That is long-standing, at least 30 years federal law under the Hyde Amendment. I believe we have accomplished that goal. I also have fought hard to protect the right of states to regulate the kind of insurance that is offered and to provide health insurance options in every state that do not provide coverage for abortion. I know this is hard for some of my colleagues to accept, and I appreciate their right to disagree, but I would have not voted for this bill and would not vote for this bill without those provisions. I'd like to acknowledge the assistance of the administration in working with us as well, and perhaps the most remarkable of all has been the leadership of Majority Leader Senator Reid. To craft this landmark legislation and to shepherd it through the legislative process and deal with the many competing interests associated with this legislation and acquire the necessary votes to end the filibuster is an accomplishment of historic proportions. I truly believe this legislation will stand the test of time and will be noted as one of the major reforms of the 21st century, much like Social Security, Medicare, civil rights legislation were milestones of the 20th century. And because of Senator Reid's dedication and hard work, the lives of millions of Americans will be improved. Lives will be saved, and our health care system will once again reflect the better nature of our country. I'd like to take a moment to talk about something that will likely fall on deaf ears. The debate about health care debate has been passionate, and I believe it's been good for the country in many ways. From the far right to the extreme left, the American people have voiced their opinion. That is good. That is part of our democracy. What has been disheartening about this debate are the reckless and ludicrous claims that have been hurled at one another from both sides in the heart of the debate. Opponents of this legislation are not less patriotic or insensitive to the health care crisis we face in America, and supporters would not be standing here today if for a moment they thought this legislation would cause harm to the American people. But yet, if you turn to the news and read some of the statements and listen to others coming from both sides of the debate, you would think otherwise. The quality of this debate has not always measured up to the quality of the American people. We can do better. There's still much work to be done before this legislation becomes a reality. In the weeks ahead, I look forward to working with my colleagues on both sides of the aisle to make it an even better bill. And without in any way intending to be threatening, to be more in the mode of promising, let me be clear, this cloture vote is based on a full understanding that there will be a limited conference between the Senate and House. If there are material changes in that conference report different from this bill that adversely affect the agreement, I reserve the right to vote against the next cloture vote. And let me repeat it. I reserve the right to vote against the next cloture vote if there are material changes to this agreement in the conference report. And I will vote against it if that is the case. I know it's hard for some of my colleagues to accept, and I appreciate their right to disagree, but it's clear I wouldn't have voted for this bill without these provisions.
With the you had a long list of other concerns about this bill. How were those sewn up, and what might be in this for you?
Well, what's in it for me is what's in it for the people of Nebraska and the country. First of all, I have opposed any kind of public option that would undermine the private insurance of 200 million Americans. I didn't believe that the expansion or the buy-in on Medicare was an appropriate way to deal because that was more of a public plan rather than let the private market prevail, as I believe that it will. I raised certain concerns about other provisions in the legislation, and let me refer to a few of them. I was concerned about the flexible spending account cap, but that now will be dealt with. I was worried about both the rural hospitals and home health care and nursing homes. I believe that is being addressed. These are all issues that affect not only my state, they affect every other state, but because of my experience and knowledge of it, both as a senator and a former governor, I requested changes, and I believe those changes will be made and will be announced. I was concerned about Medicaid and the fact that that becomes an underfunded federal mandate. I believe that that will be addressed, and there will be comments about that. I think that there needs to be further work done on the so-called mandate to find a way to, within the world of insurance, to create open enrollment and closed enrollment periods rather than financial penalties to get people into the system to avoid the problem. The obvious problem you get with adverse selection if everybody is not in the insurance package and you have eliminated the restrictions on pre-existing conditions. Concerned about medical malpractice, I believe we're going to work on a study to look to see what works in medical malpractice, tort reform, I should say, based on certain states to find more information out about it. I think there are a lot of thoughts about how this should work, but not necessarily any data that would tell us what is the appropriate way to handle it.
Senator, on Medicaid, can you be specific on? It looks, just from reading the Medicaid, it looks like your state has been singled out to get full federal funding as opposed to the state federal.
I'm going to leave it up to the.
And there you have it. Senator Ben Nelson becomes the 60th vote for the Democrats so that they can move forward on this health care legislation. This is breaking news right now on Capitol Hill. Let's go to our congressional correspondent, Luke Russert. And Luke, what did Senator Ben Nelson get, and how big a deal is this?
Well, what Senator Nelson got was, in his opinion, explicit language that said that the Hyde Amendment from 1976 will continue, that there will be no federal funds for abortion in this health care reform plan. And something that he was really concerned about, Nora, was the ability for the government to look at the transparency of the public funds in the private plans and see exactly where they went. He's now comfortable that those funds will not go to abortion. He thinks that there's things here in place in this compromise that will really be a good set of eyes over this money. One thing I found really interesting, though, from this press conference, Nora, and it shows you there's still a long way to go here on health care reform, when Senator Nelson said, quote, "I reserve the right, if there are material changes in the conference report, to vote against this bill." What's that mean? If this goes to conference and the folks over in the House who are decidedly more liberal try and change the language in this bill, Nelson has said here today on Saturday that he will vote against it. So this is essentially saying, Ben Nelson is saying, look, I agree to this legislation. I will not vote for anything else or anything different at this time. That is big, because that means that progressives in the House can't get their public option, can't get the Medicare